This is a question paper asked for second semester BSc Nursing students for their regular examination in February 23. The subject is Nursing Foundation. The total time for the examination is 3 hours and the maximum marks is 75. This is a question paper that is asked for second semester BSc Nursing students for their regular examination in February 23 for the subject of Nursing Foundation. Total time for the examination is 3 hours and the maximum marks is 75. So we'll see the questions one by one. The first sections of questions are of objective type. So 12 questions are there in that type. Okay, we will see one by one. First question is the nursing diagnosis describes human responses to health conditions that exist in an individual is called options actual diagnosis, B risk diagnosis, C wellness diagnosis, and D syndrome diagnosis. Correct answer is actual diagnosis. Diagnosis describes the actual problems or the problems that exist in the patient. Next question is the best method of sterilization of rubber glove is options A hot steam, B autoclaving, C sunlight, and D glutaraldehyde solution. The correct options or the right answer is autoclaving. Autoclaving is the method of choice for sterilization of rubber goods like rubber gloves. Next question, third question is 1 ounce is equal to 1 ounce is equal to options A 10 ml, B 20 ml, C 30 ml, and D 40 ml. Correct answer is 30 ml. 1 ounce is equal to 30 ml. Next question is comfort device used to prevent foot drop is. The comfort device used to prevent foot drop is options A footstool, B footstep, C footrest, and D foot roll. Correct answer is footrest. Fifth question. Stomatitis is inflammation of the options stoma, B mucous membrane of the mouth, C gums, and D roots of teeth. Right answer is mucous membrane of mouth. Inflammation of the mucous membrane of the mouth is called stomatitis. Next question. Aphasia means. Meaning of aphasia. A. Difficulty in walking. B. Difficulty in communicating. C. Difficulty in writing. And D. Difficulty in drinking. Right answer is difficulty in communicating or difficulty in speaking. It is called aphasia. Next question. Effleurage means A. Massage the back with a short quick stroke. B. Massage the back with smooth long strokes. C. Massage the back with smooth and quick strokes. D. Massage the back continuously. Right answer is massage the back with smooth long strokes. Next question. The movement of the thumb across the palm to touch fingertips on the same hand as touch thumb to each finger is called A. Flexion, B. Extension, C. Opposition, and D. Hyperextension. Right answer is opposition. Opposition of the movement of each finger or touching each fingertips with the thumb. That is opposition. So the right answer is opposition. Next question. The position given to the patient while administering enema is A. Left lateral position, B. Lithotomy position, C. Knee chest position, D. Fowler's position. The right answer is left lateral position. Left lateral position is advised for a patient while administering edema. Sorry, enema. Next question. The agreement to keep promise is known as A. Autonomy, B. Beneficence, C. Justice, D. Fidelity. Answer is fidelity. Next question. Appropriate first aid measure for dog bite includes all except A. Wash the area, B. Watch the dog, C. Apply bandage, and D. Remove the patient from the dog. Actually, this is a slightly confusing question because the options given are wash the area. A is wash the area, but this is included in first aid. Okay, immediately after biting, when one sees the victim of a dog bite, the area should be washed with soap and water. So that is a right answer. And the B is watch the dog. So watch the dog is also a must. So the dog should be watched for continuously for 10 days. Okay, so that is also a right option. Third one is apply bandage. This is also a right option because dressing or bandage is applied on the wound for further contamination, for preventing further contamination. Then the last option is remove the patient from the dog. That's also actually needed. So if the dog is standing nearby, we should keep the patient away from the dog. So maybe the right answer is remove the patient from the dog. So here we can consider that, or we can conclude that the right answer is here is remove the patient from the dog. All other options are must. Next question. Hypothalamus controls A. Body temperature, B. Pulse, C. Respiration, and D. Blood pressure. Hypothalamus controls body temperature. So the next type of questions are differentiate between questions. So there are two questions in this question paper and each question carries 2 marks. So we'll go move on to the first question. Differentiate between hyperthermia and hypothermia. So total 2 marks are there. So from hyperthermia 2 points are included and from hypothermia also 2 points. So the 2 points are one, hyperthermia is in hypothermia body temperature rises above 140 degrees centigrade or 104 degree Fahrenheit. And the second point is it is a serious medical condition caused by prolonged exposure to heat or excessive physical activity. So these are the 2 points included in hyperthermia. The first one is in hyperthermia the body temperature rises above 40 degrees centigrade or above 104 degree Fahrenheit. And the reason for the occurrence of hypothermia is prolonged exposure to heat or excessive physical activity. Then comes to the hypothermia. So hypothermia is a condition in which the core body temperature is less than 35 degrees centigrade or less than 95 degree Fahrenheit, and it is usually caused by prolonged exposure to cold temperature. So in hypothermia the 2 points are hypothermia. In hypothermia the body temperature is less than 35 degrees centigrade or 95 degree Fahrenheit, and the reason for the occurrence of hypothermia is prolonged exposure to cold. These are the 2 points. Next question is hypertonic solution and hypotonic solution. Differentiate between hypertonic solution and hypotonic solution. So in hypertonic solution, it is a solution with a higher concentration of solutes than that of plasma or body fluids. So in hypertonic solution, the concentration of solute is more than that of our body fluids. And the second point, this concentration difference causes water to move out of the cell into the hypertonic solution, potentially leading to cell shrinking. So here our body cells will shrink because uh, the solvent particles, here the solvent particle is water. So water will move from the cell to the hypertonic solution. So because of the movement of the solvent, that is the water from our cells to the hypertonic solution, the cells will shrink. Examples for hypertonic solutions are 10% dextrose or 3% NaCl or seawater. These are the three examples given for a hypertonic solution. You know that in our body, the normal saline concentration is only 0.9 percentage. So in hypertonic solution, 3 percentage 3 percentage sodium chloride solution is always hypertonic because here the concentration of a solute means sodium chloride is more than of our body fluid. And the second one is hypotonic solution. So hypertonic solution is a solution with a lower concentration of solute than that of plasma or body fluids. So here in hypertonic solution, the concentration of the solute is less than that of body fluids. So here what happens, this concentration difference causes water to move into the cell, causing it to swell. So just opposite what is happening in hypertonic solution. Here the solvent particles or the water will move into the cell, leading the cell to swell, or there is an increase in size of the cell, whereas in hypertonic solution the cell will shrink. If the body fluids or body is exposed to hypertonic solution, the water will enter into the body cell, causing it to swell. Example are 0.45 percentage of normal saline or half normal saline. So you know that a normal saline concentration is 0.9 percentage. So in half normal saline solution means it is a 0.45 percentage of NaCl. 0.45 percentage of NaCl is a hypotonic solution. Then second one is 2.5 percentage dextrose. These are examples for hypotonic solution. So two examples have been given. One is 0.45 percentage of NaCl or half normal saline. The other name is half normal saline. And the second example is 2.5 percentage of dextrose. Whereas in hypertonic solution, the dextrose concentration is 10 percentage. So 10% dextrose is a hypertonic solution, and whereas 2.5 percentage dextrose solution is a hypotonic solution. This is also a 2 marks question. List down questions. So list down questions are two. The first question is four qualities of a nurse. Here you are asked to just list down only. No need to explain. No need to explain each quality. Just list down the quality only, and you have studied many qualities of the nurse. Out of that, you just list down only four qualities. And the qualities I have given in this slide is empathy, sympathy, courtesy, patience, and honesty. Empathy, sympathy, courtesy, patience, and honesty. Next list down question is four guidelines for documentation. Four guidelines for documentation. One is completeness, and second one is accuracy, third one is legibility, and fourth one is objectivity. And I have given a brief explanation of each quality. First quality we will see completeness. Document should include all relevant information such as patient's assessment, findings, interventions, and patient responses. So you just explain it in one word, completeness. So all the documents should complete. It should complete. That includes patient assessment data, interventions and patient responses or evaluation. And second one is accuracy. Use precise language and avoids subjective language like appears or seems. So when you record patient's information or patient's data, you record it very precisely and avoid ambiguous language or avoid words like appears or seems like. So only factual information you should record, not your guessing should not be included in the nurse's record. So the factual information only should be included always. And the third quality is legibility. Ensure that all documentation is clear and easy to read. It should be clear and easy to read. Then record should be legible. And the fourth one is objectivity. Document only facts and avoid personal opinions or judgment. Your judgment or your opinion or your advices are not included. Just record only the facts. So these are the four guidelines for the documentation of the patient. One is completeness, second one is accuracy, third one is legibility, and fourth one is objectivity. Next is short answer type questions. There are five questions. First question is barriers to effective communication. So each question carries 5 marks. So for each short note, it carries 5 marks. The first one is barriers to effective communication. Barriers to effective communication. So what is barrier? Barriers to communication are obstacles that prevent information from being transmitted effectively and understood between individuals or groups. So there is in barriers of communication means they are obstacles that prevent conveying of messages or information from sender to recipient. There is an obstacle between the sender and the recipient. So it prevent information from transmitting from sender to recipient. So the common communication barriers are, first one is a physical barrier. Physical barrier means they are obstacles in the physical environment that hinder the transmission or reception of messages. Examples are noise, physical distance between individuals, technical issues like a faulty phone line, poor internet connection, closed doors and cabins, and all will distort communication between individuals. So the first one is a physical barrier. Physical barrier means they are physical obstacles that prevent information from being transmitted from sender to recipient. Examples are a closed room or closed cabin, or distance between two individuals who are communicating, or technical issues like faulty phone line or poor internet connection, noise in the room. So all these are physical barriers. So all this will distort communication between individuals. And the second one is physiological barrier. Physiological barrier, this occur when the sender or recipient has any physiological issues like speech or hearing difficulty, problem with vision, or difficulty in expressing ideas. So physiological barrier means there is a physiological deficit in the sender or in the recipient. So examples are hearing difficulty or aphasia. Like aphasia means it is a communication difficulty or hearing difficulty. Then problem with the vision or difficulty in expressing ideas. All this will come under physiological barriers. And the third type of barrier is psychological barriers. Psychological barriers, this is concerned with the state of mind of sender or receiver that make it difficult to understand the information that is conveyed. Strong emotions like fear, anger will impede clear communication. So psychological barrier means it depends on the state of mind of a sender or recipient. So if they are under strong emotional pressure, or like fear or anger, that will impede clear communication. And the fourth type of barrier is a language barrier or semantic barrier. Language barrier or semantic barrier, like speaking in different languages or having varying accents, can create a communication challenges. So, both are speaking in different languages. The language will be the one language one speaks may be unknown to the other person. So, there will be a problem with the communication, or having various varying accents, like all this will create a language barrier, language problems. And the fifth one is cultural barriers. Different cultures have a varying communication style or etiquette and expectations, which can lead to misunderstanding. So cultural differences will be there. So the body language will be different in different culture, so that will create problems like or misunderstanding problems. And the next one is linguistic barriers, means using technical jargon that is not understood by audience. Poor vocabulary, lack of clarity in language, etc., will lead to poor communication. So you know that the language or the words used by medical people will not be understood by the common layman. So this or the jargons used, all this will be not familiar to the layman. So these they will create problems in communication, and totally they are called linguistic barriers. And the last one is environmental barriers, lack of privacy, overcrowding, lack of ventilation and light, all have a negative impact on communication between individuals. So these are environmental barriers, lack of privacy, overcrowding, lack of ventilation and light. So these all will have a negative effect on communication. So these are the barriers of communication. So barriers of communication means that they are obstacles that prevent transmission of messages from sender to recipient. So the various type of or they can be classified under physical barriers, physiological barriers, psychological barriers, language barriers, cultural barriers, and linguistic barriers, and environmental barriers. Next short answer type question is a chain of infection or infection cycle. Chain of infection. So this question carries 5 marks. We'll see how to write the answer. An infection is the entry and multiplication of an infectious agent in the tissues of a host. The presence of a pathogen does not mean that an infection will begin. An infection occurs as a result of a cyclic process. The 6 components in the infection cycles are: one is infectious agent, second one is reservoir, third one is a portal of exit, fourth one is a mode of transmission, fifth one is a portal of entry, and sixth one is susceptible host. So an infection occurs when the infectious agent enters into the body and it has to multiply for causing an infection. So just entry of an organism into a susceptible host doesn't mean that an infection has started. For an infection has to occur, a cyclical event is needed, or a cyclic process is needed. And there are 6 elements in this infection process, and these elements are: one is infectious agent, second one is reservoir, the third one is a portal of exit, fourth one is mode of transmission, and fifth one is portal of entry, and sixth one is a susceptible host. So 6 elements are compulsory required, or 6 components are essentially required for an infection to occur. Just entry of an infectious agent or a pathogen into a host doesn't mean that an infection has occurred. It has to enter into the susceptible host and it has to multiply. Then only an infection will occur. So the first element is a infectious agent. Some of the more prevalent agents that cause infection are bacteria, viruses, fungi, and protozoa. Bacteria are the most significant and most commonly observed infection causing agent in the healthcare institution. So, infectious agent means it is the organism that is responsible for causing the infection. So, the common agents are bacteria, viruses, fungi, and protozoa. But out of that, the most significant and most commonly observed infection causing agent is bacteria. And the second element is reservoir. Reservoir means a reservoir is a place where a pathogen can survive but may or may not multiply. The reservoir for growth and multiplication of microorganisms is the natural habitat of the organism. Possible reservoirs that support organisms pathogenic to humans include other humans, animals, food, water, milk, and inanimate objects. So, reservoir infection or reservoir means it is the normal habitat of the microorganisms. So, the microorganisms normally it is seen in reservoir. From the reservoir, it has to reach a susceptible host. So, reservoir is a place where a pathogen can survive but may or may not multiply and cause the disease. So, it is the normal habitat of the microorganisms. Next element, next element is a portal of exit. The exit from the reservoir is the point of escape for the microorganisms. There is usually a primary exit route for each type of microorganism. In humans, common escape routes are the respiratory, gastrointestinal, and the genital tract and breaks in the skin. Blood and tissues can also be an exit for pathogens. So, portal of exit means it is the ways, it is the route through which the microorganisms exit from the reservoir. So, there is usually a primary exit or route for each type of microorganism. In human beings, the normal routes through which the microorganisms escape from the body are or exit from the body are respiratory tract, gastrointestinal tract, genitourinary tract, break in the skin, blood and tissue can also be an exit for pathogens. So through this route, microorganisms come out of the reservoir. So once the microorganisms come out of the reservoir, it has to reach the new host through a mode or through a way. This is known as a mode of transmission. So an organism may be transmitted from its reservoir by various means or routes. Some organisms can be transmitted by more than one route. Organisms can enter the body by way of the contact, contact route either directly or indirectly. Direct contact involves proximity between the susceptible host and an infected person or a carrier such as occurs in touching, kissing and sexual intercourse. The indirect contact route involves personal contact with an inanimate object such as contaminated instruments. It is known as fomites. Contaminated blood, food or water are vehicle route of transmission. Vectors such as mosquitoes, ticks and lice are non-human carriers that transmit organisms from one host to another. Microorganisms can also be spread through the airborne route by droplet when an infected person coughs, sneezes or talks, or by droplet nuclei when the organisms becomes attached to dust particles. So mode of transmission means it is the way by which the microorganisms reaches the new host once it is escaped from the infected person. So it is transmitted through various routes. The various routes are one is direct contact. Direct contact means there is a direct contact or close proximity between the infected person and the healthy person. So it can happen in by touching, kissing, and sexual intercourse. So, in this method means there is a close proximity between the infected person and the healthy individual. Next one is indirect contact. Indirect contact means the articles contaminated by the pathogen is in contact with the healthy person. Example, the articles used by the infected person like a bed sheet, face towel, etc. If it is used by another person, the microorganisms can transmit to the new person. This is known as a indirect contact. And the inanimate object that has the power to transmit the microorganism is known as fomites. This is the term used for an inanimate object or a contaminated instrument. It is known as a fomite. Then the other mode of transmission are it is through blood. Blood, it is known as blood-borne infection. Then microorganisms can be transmitted through to a new host through food or water. Then next one is vectors such as mosquitoes, ticks and lice. So they carry the microorganisms in their body and it uh, transmits this infectious agent to a healthy person. Next one is uh, airborne route. Airborne route means when an infected person cough or sneeze, the drops or the saliva that is mixed with the microorganisms reach to the healthy person. So these are the mode of transmission. So in nutshell, the mode of transmission are the direct contact, second one indirect contact, then third one contaminated blood, food, water, then vectors like a mosquito, ticks and lice, and the next one is droplet infection. Then the other element is portal of entry. Portal of entry means it is the point at which the organisms enter into a new host. The entry route into the new host often is the same as the exit route from the reservoir. The respiratory, gastrointestinal, genitourinary tracts and the skin are the most common entry points. So, portal of entry means it is the route through which the microorganisms enter into the new host. So, it is the same as that of portal of exit. So, respiratory diseases, the organisms enter through the respiratory tract. Then gastrointestinal diseases means it enters through the gastrointestinal tract. Then genitourinary tract, skin, a break in the skin and mucous membrane. All these are the entry route. The next one is susceptible host. A susceptible host is any person who is at a risk for infection. Susceptibility is degree of resistance the potential host has to the pathogen. Susceptibility is degree of resistance the potential host has to the pathogen. Impairment of the body's natural defenses and a number of other factors can affect susceptibility to infection. Susceptibility host means once the pathogenic organisms enter into a new host, our body will fight against the infectious agent or pathogen. You know that lymphocytes, phagocytosis, all these things you have studied. We have macrophages. So macrophages will engulf the pathogenic organism. So our body has a defense mechanisms. So all these defense mechanisms will fight against the pathogenic organism. And if our body wins, the infectious agent is defeated, and if we are susceptible or if the host is susceptible and weak, the microorganisms will win and it will cause infection.